This video continues Chapter 14 of OEC6, looking at allergies and anaphylaxis. And in this video, we're going to look at causes of allergies, and we're also going to look at categories of allergic reactions. So a couple of key terms are symptomatic terms, pruritus and urticaria. Let's begin. Common causes of allergies can be both seasonal and chronic, occurring throughout the year, or seasonal. And so we're familiar with some of those. Food allergies, we think of the route in this case is going to be ingestion, but peanuts, shellfish, some people are allergic to soy, for example. But then we also have the possibility of injected allergens, such as insect bites and stings, and inhaled allergens, pollen or pet dander, for example, or even mold spores. Other possibilities include allergic reactions that may occur to medications or particular chemicals. In a topical case, many people have an allergy to latex. That's why as patrollers, we make sure we have nitrile gloves. Now, really diving deeper into common causes, peanuts are the #1 cause of allergic reactions to food in the world. Children are more prone to this allergy than adults. We also have other allergies to be mindful of, latex as mentioned on the previous slide, or things like dust mites or pollen in the air. We want to be mindful of the allergic reaction that results, and in some cases, allergies may have a genetic component. Now, categories of allergic reaction just simply range from mild to moderate to severe. And in mild allergic reactions, we get skin reactions such as urticaria, which is the formation of hives or a rash. And that can appear anywhere on the body. Very commonly as patrollers, we can just, being mindful of patient dignity, expose the upper chest by the clavicle, and sometimes that rash will appear there. If we see flushed skin or severely itchy skin, that's known as pruritus. We also may encounter some tingling in and around the mouth and some swelling of the nasal mucosa leading to a runny nose or nasal congestion. Now, signs and symptoms may take minutes or even days to develop, but the effects will disappear over time or with treatment. Moving to a moderate allergic reaction, we see more pronounced symptoms. The hives can appear, as said before, on the chest or the arms. The itching is going to be worse. And we also get angioedema, which we see in this slide right here, the image of this patient with swelling beneath the skin, around the eyes, the mouth, and in some cases, it'll be on the hands as well. Moderate allergic reactions begin to affect the respiratory system because of this swelling, and the breathing can become mildly compromised. This is because bronchioles begin to constrict, and we get secretions that further that constriction. This will present itself as wheezing if you listen to the patient very carefully, and we need to be mindful of swelling of the tongue or the airway as well. Be mindful that this can lead to hypoxia potentially. Also, other body systems can be involved. We can get gastrointestinal distress, and this could be vomiting or diarrhea due to involvement of that body system. All of these effects may appear within a few minutes after exposure. For food allergies, it may take up to 30 minutes. For a medication allergy, it can be as quick as 5 minutes before we move to severe symptomatic responses. Now, severe allergic reaction is called anaphylaxis. This results in the collapse of the respiratory and circulatory systems. It's a form of distributive shock. These major changes are due to massive amounts of histamine entering the body, and so it has a response on the gastrointestinal system, both the respiratory and circulatory systems, and our skin. In the respiratory system, smooth muscles begin to constrict, so the wheezing is going to be much more severe. You will hear it. Ventilations become minimal, and there's no gas exchange within the alveoli. We get hypoxia. The tight bronchoconstriction and the angioedema, the swelling, becomes very, very pronounced. This becomes visible on the patient with tongue and lips swelling and blocking the upper airway, and involvement of the eyes as well. Our integumentary system will become very flushed and we'll get hives over the entire upper body. But most importantly, in the circulatory system, distributive shock sets in because of vasodilation. The effects are obvious within a few seconds to minutes following exposure. And so correspondingly, this patient needs to be treated very quickly. Their blood pressure can drop to a dangerously low level, leading to tissue hypoxia. This is a serious situation and can lead to death if not properly treated. We see here a summary of those systematic responses. Following a bee sting, imagine that antigen is going to cause specific antibodies and cells to respond with chemical mediators such as histamine, and the effect of that is going to be, as we said before, vasoconstriction and bronchospasms in the respiratory system. We'll get decreased output in the heart and vasodilation of the blood vessels associated with leakiness of those blood vessels, and that's where the swelling comes from, and also some of the edema that we find in the lungs. Our integumentary system, remember, we're going to get urticaria and pruritus, which is the flushing and the itching, but we also get swelling, we get edema as well. So, ranges of allergic reactions from mild to severe. We just tend to ramp up those systems. In the cases of a severe reaction, it's a medical emergency.